Let's talk about fluconazole. Welcome to Nexus Medical Media. Right, so I'm making these videos in series. Right, so I made a video on amphotericin B, which has a link in the description box. Just check that out. And also on the top right corner there is a link for flucytosine. Right, so you watch that video on flucytosine. Right, so fluconazole. Right, so fluconazole is actually an azole. Right, so what is an azole? Azoles are synthetic compounds that can be classified as either imidazoles or triazoles. Well, that will be according to the number of nitrogen atoms in the five-membered azole ring. Right, so imidazole consists of ketoconazole, miconazole, and cotrimoxazole, and these two you only find the creams, right, the topical applications. On this one you may find whole other routes of administration, but this one we are preferring topical. Triazole will include itraconazole, fluconazole, and voriconazole, right, together with these others shown, and fluconazole is what we are talking about, right? Just comparing other azoles to triazoles. These triazoles have fewer side effects, they have better absorption, better drug distribution in the body tissues, and there are fewer drug interactions, right? So on our azoles, let's just look at fluconazole, right? So you can see that its water solubility is high absorption, serum concentration in the cerebrospinal fluid is the highest among the list actually, and you can see the half-life is 22 to 31 hours, which is good, and it's excreted renally, and is the available formulations oral and IV, and as I always say, we prefer the oral, right? So the pharmacokinetics. So fluconazole is best tolerated and mostly widely used at triazole. It is well absorbed if given orally or even IV, and its bioavailability is excellent, over 80%. It is a good central nervous system penetration, and once daily dosing in patients with normal renal function is required. Right? This drug is mainly excreted renally, with 60 to 75% of it will be excreted unchanged in the urine, and dose adjustment are necessary in people with renal diseases. Right, so the mechanism of action. So fluconazole will inhibit an enzyme which is responsible for conversion of lanosterol to ergosterol. Remember I said ergosterol is important here. It's an important lipid in the cell membrane, right? So the enzyme responsible for this conversion is called lanosterol 14 alpha demethylase 5-1. Right, so what happens if we inhibit this synthesis of ergosterol? This will lead to depletion of ergosterol, and that will alter the fluidity of the membrane, and that could actually lead to inhibition even of the replication of the fungi, and that's it. That's the end. So fluconazole is actually good, right? So what are the indications? It's effective against fungal meningitis, infections with most candida species like oral thrush, esophageal candidiasis, right? So in meningitis, remember cryptococcal meningitis, is this fluconazole is, I think we use it for the longest time of all the three medications you'll be using in that regimen. Fluconazole, you use it for the longest time. Right, so you can click the link on the top right corner and watch the video on the management of a patient with cryptococcal meningitis. Right, so you're looking at the other fungal infections. Fluconazole has no activity against aspergillosis species and mucormycosis. This is used as an alternative to amphotericin B in the initial management of mild meningitis, right? So when it's mild, you may just go with fluconazole than going to amphotericin B, right? And is also taken prophylactically by end-stage AIDS patients. The side effects include nausea, headache, abdominal pain, exfoliative skin lesions, hepatitis. So fluconazole is actually a minor inhibitor of cytochrome P450 enzymes, and this will lead to increased serum levels of drugs like phenytoin. Thank you so much. If you enjoyed this video, please make sure you give it a thumbs up and don't forget to subscribe. Until next time.